When you think about the strain that health systems are under right now, when you think about how health inequality is growing, it's really quite an extraordinary time.
Whether it's capacity, workforce, or the burden of chronic disease management, healthcare systems across the world are struggling with the same challenges.
How do we address the health inequalities that sit within healthcare anywhere you care to look around the world? How do you build system resilience? How do we treat ever more patients?
We need to work with our policymakers to ensure that we're delivering the best care for all the different conditions that we have to treat.
We're thinking about how medical can really be on the forefront to really change people's lives.
In BioPharmaceuticals Medical, we have a simple and powerful purpose: to advance clinical practice and reduce the extraordinary global burden of chronic disease.
And we do this by screening and diagnosing for chronic diseases early on,
supporting the adoption of ambitious clinical guidelines,
delivering practice-defining clinical trials and real-world data,
and we help healthcare systems to redesign their diagnostic and care pathways.
It's about helping high-risk patients, making sure these patients are getting reviewed and getting the right medicines that can prevent disease progression and keep them out of hospital. We have this extraordinary portfolio of medicines that's just exquisitely aligned to what health systems need right now.
Harnessing not only our innovative pipeline, but also working and partnering directly with healthcare systems.
Healthcare systems have to be a priority. There's no other way to really be effective.
The BioPharmaceuticals Medical team are at the very centre of what we're trying to do within AstraZeneca.
We're trying to empower a team to step up and become this next generation of not just medical leader, but business leader.
I came to AstraZeneca all those years ago because we led by the science. That's always been core to what we do.
I was a doctor in clinical practice and I greatly enjoyed looking after patients, but I wanted to make a difference on a truly global stage.
The reason I've stayed is because it's not about medicines, it's about changing healthcare. And that is such a challenge that involves such innovation and creative thought. It's a job that just anybody that's interested in making a change would really want to do.
I mean, it's the main reason why I'm working at AstraZeneca, is to make sure I make a difference.
Because of the ability to work across the portfolio and the diversity of the therapy areas, that's why I wanted to join.
We need people with a diverse range of experiences and backgrounds to drive our ambition forward.
If you are a passionate, bold, innovative leader that's not afraid to step up and partner with the right people to drive change, then AstraZeneca is the place for you.
Because if you're curious, you ask questions. And if you ask questions, it means you're thinking. And that means innovation.
At the core is the patient, and innovation is part of how we can improve patient health.
Everything has to be about the patient in the end. I mean, if we don't improve the lives of patients, then what have we really achieved?
It's a great team, fantastic vision, and clear desire to transform healthcare for all.
We are ambitious, we are open-minded, we are fair.
The future's exciting. BioPharmaceuticals Medical, to me, are drivers of change.
If you care about making a difference, if you want to disrupt and leave a lasting impact on how healthcare is delivered, this is the place to be.
A team that sits at the very heart of everything we do at AstraZeneca.